Hello. This is the first of a series of videos in my maxillofacial surgery series. Looking at this slide, can we guess the sex of this skull? Would you say this is a male skull or a female skull? Um, you don't have to be a maxillofacial surgeon to be able to tell the sex of this skull. It should be pretty obvious to you. In the following slides, I want to be talking about sexual dimorphism and why downgrafting is so important when getting maxillofacial surgery. So traditionally, when maxillofacial surgeons are taught about aesthetics in school, they're taught about the rule of thirds. Traditionally, the face is split up into thirds. The top third is from the trichion, which is the hairline, to the nasion, which is the concavity just above the nose. Then the second third is from the nasion to the subnasale, which is the portion right below the nose of the columella. And then the bottom third is from the columella to the menton, which is the inferior border of the chin. In females, the rule of thirds works fine. But a thing I have a complaint about is a lot of surgeons don't understand that the rule of thirds doesn't really work on the male face. In the male face, the lower third should dominate the other 2/3. The lower third should be about 40% of the total facial height. In addition to that, the bigonial width should be about 90% of the bizygomatic width. That's another dimorphic feature that I'm going to go more in another video on. So here's another slide of a young gentleman that had maxillofacial surgery. He had downgrafting of his maxilla as well as downgrafting of the chin. In addition, the chin to philtrum ratio should be about 2.5 to 1. The philtrum is from the subnasale to the stomion, which is the lip where the lips meet, and then the chin from the stomion to the menton, that should be about 2.5 times of the philtrum ratio. So in this slide demonstrates the chin to philtrum ratio, about 2.5 to 1. In addition, the lower quote unquote third should be about 40% of the total facial height. The lower third should be slightly disproportionate. And now I want to talk about a few case studies of downgrafting as well as maxillomandibular advancement. This is a case from Gunson, who's a surgeon in California, Southern California. He has he has a short face with poor tooth show. Generally speaking, in repose, which is when your face is relaxed, you should have a couple millimeters of your upper incisal show in repose. And when you smile, you should have 1 to 2 millimeters of gingival show, or 1 or 2 millimeters of gum show when you smile. In addition, you want to have a wide smile. It's called a smile arc. And a lot of times people have a narrow maxilla and they need a maxillary expansion so they can fill out the smile. A lot of people have a transverse deficiency. You can see how much more masculine he looks after the downgrafting of the maxilla. I don't know if he had downgrafting of the chin in this case study. So here's a Hernandez Alfaro patient. His name is Pablo. You could see in repose he has poor tooth show, or when you smile, he's not showing a lot of gum. And he had down grafting of the maxilla and the chin. A lot of times too, they open up the bite to increase the facial height as well. A lot of these patients, they have a deep bite. This is the anterior posterior view. So here's the profile view of Pablo. You can see um, the maxillomandibular advancement, um, the menton or the pagonion in the lower lip, it surpasses or goes past the nasion, in addition to the lower third that he gained. In addition, you can see with the maxillary advancement, the nasolabial angle becomes more acute. If you look at the nasolabial angle on the left side, it's around 130 degrees, where when you advance the maxilla, the upper philtrum becomes more proclined and the nasolabial angle becomes more acute, closer to 90 degrees. And this is an AP view of the plan that he received, downgrafting of the maxilla and downgrafting of the chin. And this is a profile view, downgrafting of the maxilla, downgrafting of the chin, as well as maxillomandibular advancement. It also appears that he actually got clockwise rotation. If you look at the anterior nasal spine, it looks like the anterior nasal spine came a little down more than the posterior nasal spine. So when you rotate clockwise, you gain facial height as well. It's important to pay attention to the occlusal plane, which is the plane that the teeth meet at. The normal occlusal plane is around 8 degrees, but if you have a relatively flat occlusal plane, it'll bring your face out more. It's just important to note that when you rotate counterclockwise to bring out your jaws, you lose vertical height. So when you rotate counterclockwise, you want to downgraft at the same time, so you don't lose facial height. So this is Gustavo. You can see in the before photo, poor tooth show, short face, no no gingival show. On the after, there's not really a lot of gum show either. So we go to the next slide. So you can see he had maxillomandibular advancement with downgrafting. You can see the nasolabial angle in the before, it's like around 130 degrees, and the after it's more closer to 90. You can see the lower lip, or the labial mental fold is way behind the nasion, where the pagonion and the labial mental fold is right in front of the nasion in the after photo. And here's a profile view of the maxillomandibular advancement. You can see in the BSSO how much was advanced. You can see that he got, looks like clockwise rotation a little bit. Open wedge genioplasty on the bottom. A lot of surgeons don't do open wedge genioplasty too. They just slide the chin forward. And when you slide forward, you actually reduce the vertical height, and it results in a step off as well. So you don't want to slide it forward in the traditional sense of what they call sliding genioplasty. You want to continue the line down and move the chin down and forward, and not actually slide it forward. Usually they put some kind of cadaver graft or a graft from the iliac crest to downgraft either to the maxilla or the chin. And here's the anterior posterior view of Gustavo. You can see the huge downgraft he received in the maxilla. I'm pretty sure that they did some kind of bone grafting there. And this is Pelly, or Paley. You can see in the before photo, he looks almost like a kid. And the after, he looks so much more masculine, like he's like an adult. It's mainly due to the maxillary advancement. It makes you look more mature, almost. And he also received downgrafting, but he actually got some counterclockwise rotation as well, in addition to the downgrafting. Also in this case study, his occlusal plane was a little bit of canted a little bit, so his occlusal plane was leveled out. You can see the downgraft of the maxilla. And you can see the profile view, the downgrafting of the maxilla, the maxillomandibular advancement, and they actually slid the chin forward in this. I really don't like that, how they slid it forward because you lose vertical height. I like bringing it the open wedge genioplasty where it's actually like a hinge. It's hinged downward actually because um, the labial mental fold is less deep when you do it like that. I want to show you some examples of celebrities that are known to be masculine. They have hypermasculine faces. This is Dwayne Johnson. You could see that his chin to philtrum ratio is probably 4 times the philtrum. A lot of people might say it's excessive. Some people might say that, but I think it looks good. It looks hypermasculine. Maybe as far as a model goes, a male model, it might be a little excessive, but I think this demonstrates hypermasculinization of the male face. This is Alex Pereira, UFC fighter. You can see the chin to philtrum ratio is probably about 3-to-1. You can see the lower third from the menton to the subnasales, like 40% of the other 2/3. I think this looks like hypermasculine. And this is an Alfaro patient. He actually had vertical distraction of his jaw before, I guess, maxillomandibular advancement. I've never really seen, this is the first time I've ever seen vertical distraction, but I think this case was done in 2 stages. The mandible was distracted down, and after it was distracted down, both jaws were brought forward. You can see the chin to philtrum ratio is about 3-to-1, and you can see the lower third dominates the other 2/3 of the face. And I want to touch on the vertical lengthening genioplasty or open wedge genioplasty. I'm not really a big fan of the genioplasty in and alone, because what happens is if you advance the chin and then you decide you want to do a counterclockwise rotation later on, then the chin will become too strong and the chin actually has to come back if you want to do MMA or maxillomandibular advancement later. So it's better to do MMA first, see how you look, and then do the genioplasty. But nonetheless, this gentleman had a vertical genioplasty. You can see how much more masculine he looks. It's important to note that when you advance the chin, the pagonian or the anterior most part of the chin should never surpass the lower lip. That's just a general rule of aesthetics. So you're with a genioplasty, you're kind of limited on how far you can bring the chin forward by the jaw. So if you do MMA, there's way more room for advancement overall. And this slide demonstrates that women can benefit from the vertical genioplasty as well, not just men. You can see that by lengthening her chin, how much more elegant or sophisticated she looks compared to the before. And this is an intraoperative photo of me getting downgrafting by Sunil Richardson. He did increase the height of my vertical third significantly. However, he didn't bring my jaws forward enough. So that's my main complaint of the surgery. You could see the gap of the maxilla He should have done more bone grafting. He did harvest bone from the iliac crest and put it by the posterior nasal spine. And here's a CT scan showing before and after. I actually had two genioplasties. The first genioplasty I had with Dr. Epley, and it was actually very asymmetrical. I gained about 8 or 9 or 10 millimeters from the vertical genioplasty from him. And then from Sunil Richardson, Sunil actually brought my chin down and back, which is part of the plan that I had. But you can see just the ratio is how much more vertical height. If you look at the root of my teeth to the menton, how much more vertical height there is compared to the before. You know, if you look at the first slide of the presentation and you look at the second photo here, that's the idea that I was striving for. If you look at the before photo here, you know, I almost had like the skull of almost like a child almost. So I really wanted extreme down grafting. And here's another intraoperative photo comparing the vertical height I gained after the genioplasty and then the vertical height after the MMA. MMA and then another 5 millimeters of the genioplasty plus down grafting of the maxilla. Here's an after photo showing the vertical height that I gained after down grafting the maxilla and down grafting the chin. I was trying to follow the principles, you know, on the earlier slides of this video. You know, I was trying to be as like dimorphic as possible. And here's some intraoperative photos of down grafting of the first, or the intraoperative photos of the first genioplasty from Epley, and then the second photo is a second genioplasty from Sunil Richardson where I brought the chin down and back. So this is a famous movie star, Chuck Connors. You can see the chin to philtrum ratio is about 3:1. You can see the lower third dominates the other 2/3 of the face. It's just important to note that, you know, I'm just surprised by how many surgeons aren't doing down grafting. That's one of the reasons I went to India, is I wanted a full down graft of my maxilla. And the surgeons in my local area, I guess they didn't feel comfortable doing down grafting, or they didn't understand the reason behind it, or we had a fundamental disagreement about down grafting. So that's one of my complaints, is that not enough surgeons are doing down grafting. They should always be doing down grafting, unless you have a really gummy smile. I think in men they should be doing down grafting. They should be down grafting the maxilla, down grafting the chin. Expands the facial skeleton. It helps you show more teeth. So that's just my main complaint, is that more surgeons aren't doing down grafting. In the upcoming videos, I'm going to be doing videos on cephalometric analysis and just other guides on how to make your face look more masculine. Thanks for watching this video.